Well, in the age of the selfie, it seems looks hold more value than ever before. But what's the science behind a facelift? Does it really help? Joining us with some insight is Dr. Sabrina Fabi. All right, Dr. Fabi, great to have you back.
Yes, nice seeing you, Jen.
All right, let's talk about this new study with plastic surgery and how it impacts sort of how we view ourselves, our self-esteem, our self-worth.
Well, this was a study that was actually carried out by one of my friends and colleagues who does a lot of facelifts. I mean, that's primarily his practice in New York. And this was a study that he carried out on 59, 57 of which were women and 2 which were men, people that had undergone facelifts in 2013. And what they were doing was trying to basically give them a bunch of self-esteem tests to determine whether undergoing a radical procedure like a facelift actually increased their self-esteem. And surprisingly, what they found is that they didn't see that. Patients that rated themselves with high self-esteem to begin with actually ended up having lower self-esteem after the facelift. And those that had lower self-esteem beforehand, it did increase to a degree, but not as much as was expected.
Really? So I would think most people were sort of right in that middle part, right? They don't have necessarily a super low self-esteem, though they may not have a super high self-esteem. So they're kind of right in the middle. So for you, Dr. Fabi, doing some of these procedures, I mean, what does that tell you as a doctor?
I think this was a great study and truly a landmark study because we see a lot of these types of questionnaires with the non-surgical procedures that I classically do as a cosmetic dermatology, as dermatologist. And what we see is that patients report themselves as looking 5 years younger and do report a high level of self-esteem. And in a pivotal trial that's going to be out soon, what they found was that after a hip replacement surgery, as far as quality of life improvement, these non-invasive cosmetic procedures actually were the second highest in quality of life improvement. So it's impressive that such non-invasive procedures can improve our quality of life, but the surgical ones that are more radical don't.
Right, and because there's so much advances in your field of cosmetic dermatology, some people are kind of getting the same results without having to, quote unquote, go under the knife.
Yes.
Let me ask you about then, what should people expect? Is this an issue of we need to sort of adjust our expectations if we want a facelift or a cosmetic procedure? And are some people maybe better suited than others?
Right, and so in this study what they found was that even though self-esteem didn't necessarily improve, it didn't mean that they didn't have a great result. And in fact, patients actually rated themselves as looking 9 years younger, which is still interesting because it's only 4 years younger than some of the non-invasive procedures, but nonetheless, they reported looking better, they reported looking younger, but they still weren't necessarily happy. So if you're going to undergo a surgical procedure, something that radical, just to feel better, then I would reconsider. I think happiness comes from within. We know that, and I think the study just reaffirms that.
Before I let you go, do you ever, when you talk to your patients, is that something that you ask them about why they're getting it done? And maybe a red flag would be raised if you definitely notice someone has very low self-esteem and thinks this could sort of be a fix?
Absolutely. I think that that's something that we all learn about in training. If I'm starting to recognize that someone is doing this just for that psychological improvement, although there is definitely evidence that these treatments do something on mood and help mood, it shouldn't be the sole motivator. And I usually encourage them to perhaps talk to someone further about what's bothering them internally before they proceed with modalities that will just help their appearance.
Yeah, well, you hope there's more doctors like you, Dr. Fabi, that aren't just looking for the quick paycheck for anybody. Thanks so much for joining us on a really interesting conversation.
Thanks so much for having me, Jen.
All right.